Welcome to this module on the use of an automated external defibrillator, commonly called an AED. This module is one in a series provided by Ellison Associates, a world leader in education, training, and aquatic risk management. Let's begin this module by reviewing the components common to all AEDs, then discuss how the device is to be used, and end the module with some precautions to follow when using an AED. An AED is a device that assists with the resuscitation of a person in cardiac arrest. The initial steps of care for someone in cardiac arrest involve providing CPR until an AED is available. It's important to apply an AED as soon as possible because for each minute that goes by without defibrillation, the chance of survival decreases by roughly 7 to 10%. AEDs come in different sizes, shapes, and colors. There are two types of AEDs, semi-automatic and fully automatic. A semi-automatic device requires the user to push a button to administer a shock if the device advises this is needed. A fully automatic device advises the user to stay clear while the device administers the shock without the need to press any button. Regardless of the type of AED, all AEDs share commonalities when it comes to operation. Ability to turn the device on and off, electrode pads to be placed on the chest, ability to analyze the heart's electrical activity, ability to determine the need for a shock, known as defibrillation, ability to discharge a shock. Before applying the AED to the person in cardiac arrest, the person's chest must be prepared. AEDs have a ready kit that includes scissors used to help quickly remove the person's clothing if needed, a drying cloth so that the electrodes can properly adhere to the chest if the chest is damp, a razor to remove heavy chest hair so the electrodes adhere firmly to the skin, medical exam gloves, and alcohol wipes. With the chest prepared, the AED can now be used. Turning the device on is as simple as pressing a button or just lifting the lid. Then follow the voice prompts.
Apply pads to patient's bare chest.
Electrodes are placed on the person's chest. Images on the electrodes show where they need to be placed. Peel the protective backing and push the pads firmly onto the chest so they make contact with the skin. For adults, the electrodes are placed on the upper right side, just under the collarbone, and on the lower left side along the lower ribs. With the electrodes on the chest and the cable connected to the AED, stand back and allow the device to analyze the heart rhythm.
Analyzing heart rhythm. Do not touch the patient.
If the AED determines that the person's heart rhythm is one that will respond to defibrillation, the shock command will be given.
Shock advised. Charging.
Be certain no one is in contact with the person before delivering the shock.
Stay clear of patient. Deliver shock now. Press the orange button now.
Once the shock has been given, provide CPR for 2 minutes, at which time the AED will advise of the need to reanalyze the heart rhythm.
Begin CPR.
If the AED advises that no shock is needed and the person is not showing any signs of life, CPR should be continued for another 2 minutes. If the person is showing signs of life, place the person in the recovery position and monitor the person until EMS personnel arrive. Now that we have covered the components and operation of an AED, here are a few precautions to be aware of when using an AED. These include water, pediatrics, medication patches, body piercings, and implanted devices. When it comes to using an AED near water, move the person at least 6 feet away from the water's edge and dry the chest. For pediatric persons up to 8 years of age and less than 55 pounds, follow the images on the electrodes for proper placement. This may require electrode placement on the chest and the back. One device uses the same size electrode pads for adult and pediatric persons. One device uses a key to quickly convert the AED from adult to pediatric mode. If a medical patch is in the way of where the electrode should be placed, remove the patch while wearing gloves and wipe down the skin before applying the electrode. There may be a time where body piercings are in the way of electrode placement. If they are, they need to be removed. There are two general types of implanted heart devices. The first is a pacemaker, used for those with heart conditions involving excessively slow or irregular heartbeats. It constantly monitors the heart and releases low electrical impulses to the heart to help keep the heart pumping at a normal pace if it suddenly becomes too slow. The second device is a cardioverter defibrillator. It is used by those who have sustained rapid or chaotic ventricular heart rhythms, such as ventricular tachycardia or ventricular fibrillation. An ICD provides an internal shock to stop the abnormal rhythm. While implanted devices are not likely to be affected by the AED, it is important to avoid placing the electrode pads directly over the internal device. Fortunately, implanted devices are not commonly positioned where an electrode pad would be placed. Thanks for viewing this module on the use of an AED. We hope this has helped to make you more comfortable with this skill. If you have any questions about this presentation, please address these to your instructor or supervisor.